Hi, this is Dr. Scott Treaty with Top Down Inside Out Chiropractic. Today we have a new patient named Jim, who's a 52-year-old male that hurt his calf. Coaching soccer, his daughter's soccer team, got in line with the girls and strained his calf. So Jim has spent 3 months in physical therapy and stretching and doing a foam roller on his leg to try to resolve this problem that, as you will see in a moment, we were able to clear up in minutes. Enjoy the video. Hope you learn something, and away we go. Jim Jonda, and he's here for Top Down Inside Out Chiropractic, and he strained his calf at his daughter's soccer practice 3 months ago now, right?
Right.
He's been through physical therapy. He's been stretching a lot on his own and rolling out the TFL, which a lot of people will do in these situations. But still, after all of that, 3 months into it, he has a short leg check. So come over here and take a look at this. Yeah, so that people can see, they can see the difference in his leg check. This is after physical therapy, with a lot of stretching, rolling out, all the stuff that he's been doing, and he's still got this deficit here. So we're gonna try to show how fast we can make that change with this Top Down Inside Out Chiropractic treatment. Okay, so also with Jim, we've got hamstring flexibility on the same side, the injured side, that really gets to about 70 degrees basically. Okay, so he's at 70 degrees before he starts to react and kind of self-protect. On the other side, he could get up to 80 pretty easily before his body starts to contract and self-protect again. Another thing, both feet off the table, and just hold it there for a second and tell us if there's any symptoms at all, anything that feels uncomfortable.
Little pain.
Where?
Back.
So his lower back has got a symptom. So what happens when you tear your calf is you irritate the nervous system down here, you insult the nervous system down here, and then what happens is that information goes back to the brain. It starts a loop between the lower back and the calf that is hard to clear until you get chiropractic care. Basically, you have to get adjusted for this to clear. It doesn't matter if you roll the calf or do something topically, eventually you're gonna have to address this. So we're gonna watch that in action right now. So other thing we gotta do is, we know that your calf is controlled by your brain through your neck, down through your upper back and your middle back, out of your back, top down, inside out to your calf. So we're going to clear the whole tract. We talked about that a little bit in the exam or the consultation. So we're looking for anything C2 left, okay, that would inhibit that. Anything on that tract. And C5 right. Okay. Let's check. Your eyes are open, and I'm just checking your pupils. Are you dizzy at all?
No.
Good. Dizzy at all here?
No.
George's test is clear, so he's safe to be adjusted. His cardiovascular system is in good shape. I think we're ready to go. You ready to go? When's the last time you were adjusted?
I can't even remember.
10 years?
Probably 15.
Yeah, it's 10, like a lot of people, it's 10, 15 years because he's in great shape, he's athletic, probably doesn't feel like he needs it. But when these things happen, you realize that the nervous system is in control of everything. It happens from brain down through the spine to the tissue. So we're going to clear Jim out, and we're going to see that we make sure it changes right now. Away we go. So we're starting with your neck. There's popping sounds, as you know. Popping sounds is just fluid exchange in the spine. Soften. Take you right there. Let it be a little scary. Good job. I know. Same thing other side at C5. Good. Good. You okay?
Yep.
Good. All right.
Did it hurt?
Come over here and look at the leg check.
No.
Wow.
Look at the leg check. Great. So it's balanced. So there's the lesson, right? This is the lesson for anybody that's watching this video. That nerve tract that controls this calf originates in the brain, and we're going to clear everything between the brain and that calf. And it's already the neck, which is so often true. He's already released his leg in a way that it can heal now. Blood flow can get there more readily. Things have already changed. We just got started. So we haven't even got to his lower back or his hip. Good job. Okay. Leg check has definitively established his balance now. Top down, inside out. And so let's go back to this hamstring. It was at 70 degrees. Pretty comfortable at 80, 85. Relatively comfortable at 90. We have not touched his calf or his hip. his lower back yet. So everything between his brain and the area that I adjusted has already gotten some relief. Heart and lungs, all of those tissues contract and expand. They're all more expanded right now. If we could measure his inspiration, which we will do in the future, you would see that he can breathe deeper. That's the same for this calf muscle, by the way. It contracts and expands. All right, we got another one in the mid to lower. Doing great, man. Excellent. I got you. Hang in there. Tough spot. We're gonna find some tough spots. Somebody that hasn't been adjusted in 10, 15 years. Okay, let's go work on this lower back and hip. Soften, soften, soften. That was harder to move. More inflammation, more resistance.
That's the side.
Yeah, for sure. Yeah, we're on to that. So here we go. We started at 70 degrees. We're out. This is 90. We'll call this 90. That's 100. He's comfortable, relatively comfortable. Bend your left knee.
Left?
Yeah, I got you. We're gonna get a little more out of this one, okay? Because you're used to. We're starting to get used to each other. First time we met. But once you get more comfortable with your chiropractor, then boom, you can get more done. Good job. So anybody that's watching this video got to understand that he's been walking around in pain for 3 months. So, and he just came in for the first time in this 3-month period, and here he is getting adjusted on the fly. Doing a great job. There is some resistance there. Soften. Relax that. Good.
That was good.
Yeah, I got that hip.
Yeah, that felt good.
That hip has been bottled up since the second that you felt that calf strain. The instant that happened, I guarantee you the hip closed now. So get squared up on the, get the pillow underneath your head for us real quick and just get nice and comfortable. Let's take a look, folks. And you've been stretching how many times a week?
3 times a day for like 12 weeks.
Okay. And do you think you ever got even close to this? There's no way. There's no way it happened. No offense to the stretchers of the world.
My best friend.
Well, the nervous system controls the muscles. They're not going to allow you to stretch that far until the nervous system's freed up. Okay. And try both feet off the table with your hand. Any pain? Remember the original symptom? I can't remember what it was.
He had a little bit of
You had some discomfort in the
little
back.
bit of low
Yeah.
back, yeah.
How's the back going now?
It's good.
No pain. Okay. Well, that's good. So that's another great example of top down, inside out, and how the body really. Why we're doing this is to show people how the body really works. I think the key thing that happened here was in the beginning when we adjusted his neck, his leg check balance. So you start to see the reality of this is the brain's controlling everything and it's doing it through your spine. So see your chiropractor more often. And when you get in these situations, he spent 3 months stretching and spent 10 minutes getting adjusted and just bypassed all of those stretching moments that he spent stretching, and we eclipsed all of that.
Okay, so I hope you learned something in this video, watching Jim improve dramatically in just minutes. After spending 3 months with physical therapy and foam rolling, we increased his hamstring flexibility by 20 degrees, from clearing the nervous system from the brain down to the calf and hamstring. Awesome stuff, right? So I hope you enjoyed the video. Don't forget to like, subscribe, and hit the notification bell, and look for more videos coming your way. Thanks.